On this episode, we talk about sciatic pain, sciatica, that miserable pain, numbness and tingling that you can have starting in the butt and going down the leg and even into the foot and ankle. Why do you have that? Some causes that you've probably never heard of, and then an easy way to fix it. So stay tuned. Maybe you've had sciatic pain for some time. Maybe it's been years or even decades that pain has been radiating down into the leg, past the knee, even into your foot or ankle. Maybe there's numbness or tingling that's going on, or even loss of function. Maybe you're losing strength into the muscles in that area, right? This is evidence that you've got a nerve problem that's been going on for some time. That nerve has been irritated for some time, right? So, what causes sciatic pain? What causes that nerve to get irritated? Because even though it might have been seemingly a quick thing that came on out of nowhere, it's not. It's a dysfunction that builds up over time. So what causes that? I'd like to talk a little bit about body imbalance. So whenever the body is asymmetric in how it loads, and that sounds fancy, but basically your posture. When the posture is twisted, when there's twisting happening in the low back and in the pelvis, you can have a lot of strain that happens first on the discs and the nerve roots that come out of the low back. At every level, L1 to L5 and into the sacrum, you have little nerve roots that pop out, pop, 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 and those little nerve roots go out, and in the lower back there, those nerve roots end up feeding what becomes the sciatic nerve. So, first, easy, simple. If you compress the nerve roots, specifically on one side, because if you can imagine, weight is going to be different on one side than the other if your posture is asymmetric, that irritation on those nerve roots can cause sciatic pain that over time, as those nerves get more irritated and damaged, can radiate further down into the leg. 2, if the muscles in the pelvis, and you'll hear a lot about the piriformis muscle, maybe you have spent quality time looking up piriformis stretches and different things you can do to take pressure off of that sciatic nerve. Well, if the piriformis muscle and other muscles in the pelvis are not symmetrical in the way that their length and their tension is, because the actual mechanics of your pelvis, muscle-wise, are asymmetric or imbalanced, that dysfunction that builds up in your pelvis can cause muscles like your piriformis muscle to become spastic. Now, your sciatic nerve, right, so those nerve roots come down and become what is the sciatic nerve. For some people, that sciatic nerve actually runs through, it pierces through the piriformis muscle. So if that muscle is in spasm or irritated or spastic, it can irritate the sciatic nerve, which can cause numbness, tingling, pain, and increasing dysfunction over time. So what causes body imbalance? That's the real question, not what's causing even the sciatic pain that you feel. What's feeding the sciatic pain? What's the real cause of body imbalance? Well, when the head and neck are off axis, that's going to cause the body to twist and compensate. Specifically, the body is always looking to keep your eyes level with the horizon. So when you have had a neck injury, car accident, maybe when you were younger you played sports, even birth trauma, something you may never even be aware that happened. The head and the neck, when those are off and those eyes are off the horizon properly, the body is going to tighten up in the low back and in the hips and pelvis and bring that entire upper body, head, neck, and shoulder girdle over to keep the eyes level with the horizon. Not a big deal if it's short term, but over years, this builds up a lot of dysfunction. 1, on those nerve roots that are exiting the low back, because there's a lot of pressure all the way to the upper body is over and off of plumb. So it's a lot of pressure on the nerve roots in the low back. And 2, the muscles of the pelvis, including the piriformis muscle, will build up dysfunction and become spastic. So you don't have balance and healthy muscle function in the pelvis, which can irritate the sciatic nerve. So I hope you found that helpful. How do you fix it? Right? You know the cause now. How do you fix it? You need to correct the alignment of the neck, head and neck, and get that back to more normal alignment, right? when you do that, the body is allowed to release out of that twisted compensating posture. The low back is allowed to open up. The nerve roots are allowed to start to break up that inflammation and start to heal, which can help ease that up. And then the muscles in the pelvis can also relax and become more symmetrical, including the piriformis muscle. Now, it's not a quick fix. In the same way that the atlas was displaced, the body twisted and it put a lot of dysfunction on all those tissues like the nerve roots. The body has to untwist and start to heal those. So over time, weeks and months, you can start to see that sciatic pain move back towards midline. It's called centralization, away from the foot, ankle, hip, back towards the low back, and start to heal up. As inflammation comes off the nerve root, the pain and dysfunction and numbness and tingling should ease up as well. I hope this has helped you understand some of the root causes that are behind sciatic pain and sciatica and some of the misery that you may be experiencing. I want you to know that your body's designed for normal function. So if it is hurting, if you are suffering, you don't have to, and you can definitely improve the function and help heal tissues. That is the normal. That's the default for the human body. So if you are experiencing that, that's not normal. So if you have questions, if you'd like to sit down with me or one of the other therapists in the office, it's always no charge to talk, kind of go over your history and see if we can help you out, if correcting that atlas is the right path to move into for you. Other than that, if you have any questions, I hope to see you at our next free workshop, our Dinner with the Doc. And thanks for watching. Please subscribe. Bye.